So, what comes into your mind when you hear the word jealousy? What kind of visual memories popped up in your mind? How do you feel about those visual memories, incidences, or relationships? Happy or sad? Secure or insecure? Comfort or discomfort? Peace or chaos? Calm or angry? Was it or is it manageable or uncontrollable and affecting other areas of your life? Hi everyone, I'm Subhashree and you are watching my channel Psychological First Aid. Today in this video part 1, we will learn about jealousy and envy, the difference between the two, abnormal jealousy or pathological jealousy, its symptoms, causes, psychobiological effects, and in part 2 we will discuss about its management plan. Now let us talk about jealousy. It is not a diagnosis, it is an emotion. But when someone experiences extreme jealousy, they may find the emotion negatively affect their life and may even contribute to the development of mental health conditions such as depression, generalized anxiety, and many more that we will discuss later. Feeling jealous sometimes is not harmful, but when you are always occupied with the feelings of jealousy, it creates an ill will for the person for whom you feel so. You may feel stressed and lose your peace of mind for clinging to pretty things. Jealous can consist of one or more emotions such as anger, resentment, inadequacy, helplessness, or disgust. Jealousy is a typical experience in human relationships and it has been observed in infants as young as 5 months. It is natural to experience jealousy in a close relationship. You may feel suspicious jealousy or reactive jealousy. The former, suspicious jealousy, is based on perception and is often tied to low self esteem and insecurities. Reactive jealousy is based on situations that actually threaten the relationship. Jealousy can lead to other emotions or feelings such as criticizing, fault finding, blaming, feeling distrust, being overprotective or suspicious, acting obsessive, experiencing a quick temper, or sometimes verbally abusing, violent behavior, self destructive behaviors. Well, it is also true that in healthy doses, jealousy can serve as a reminder to cherish or prioritize a relationship. High degree of jealousy, however, can impact the overall quality of a relationship. Now, what are the signs of jealousy? Let us discuss about that. If a person is jealous, they may show it in a wide variety of ways, like anger toward a person or situation that is interfering with something you care about. For example, parents may feel jealous when they see or feel other persons are showing more love to their children than they do. Resentment of a friend, partner, or any close person when they cannot spend time with you or spend more time in other relationship than yours. Feeling of dislike toward a new person in a loved one's life that are hard to explain. For example, elder sibling may not like his or her newborn sibling and may start to perceive him or her as a competitor. Other signs like deep sadness or feelings of distance when thinking about a partner, friend, or a loved one. A person may feel insecure, rejected, worried, angry, or self doubting. Now, what are the common causes of jealousy? These are like communication issues, low self esteem, loneliness, or differing interpersonal boundaries. What are the types of jealousies? Like rational jealousy, when there is genuine, reasonable doubt. The base is real and the threat is real, especially when you love a partner and fear losing them. Rational jealousy can occur. Family jealousy. This typically occurs between family members. Sexual jealousy, when there is fear that a partner has been unfaithful and has engaged in physical infidelity, you may become suspicious. Romantic jealousy, this can result from a real or imagined threat to a romantic relationship, resulting in jealous thoughts or reactions. Pathological or abnormal jealousy, we'll discuss it later after envy. Now, what is envy? Is there any difference between the two? I mean, is there any difference between jealousy and envy? The answer is yes. Jealousy and envy are two distinct emotions. While jealousy can be described as a fear that another person may take something that is yours or something you consider to be yours, envy is the desire for something that belongs to someone else. Envy is more likely to cause feeling of sadness and a desire to change. Meanwhile, jealousy is more likely to provoke anger and resentment. Envy happens in power and status. Both are unhealthy if in extreme form. Signs of envy are like the person is not happy for others when they achieve success. The person may feel the need to diminish someone else's success, may judge others negatively. The person having envy, happy to see that the person is in trouble. Envious people praise in front of you but would tell lies or gossip about you behind your back. They may try to mimic your behavior and imitate every single thing you do. At first, you will find this flattering, but sooner or later, it will start to get really irritating. They're obsessed with what you have and they desperately want the same. They flaunt their successes, often more than their actual merit. They deliberately give you bad advice or simply discourage you from even trying. They are very competitive, especially at workplace. They will criticize you. They are great plan spoiler. For example, if you have decided to choose a career of your choice, they will constantly tell you about the negative side of it. They will humiliate you in front of other people. They hate you or dislike you for no reason at all. Sometimes you feel surprised by their behavior or feel you may feel wonder that why the person is behaving like this. They always try to steal the spotlight. They don't show any interest when you share your success or any happy incident with them. They constantly tells you you are wrong. They make you feel bad about yourself. Now let us discuss about abnormal jealousy. It is also called as pathological jealousy, extreme jealousy, morbid jealousy, delusional jealousy, or Othello syndrome in case of romantic or sexual partner. So, what are the symptoms of abnormal jealousy or pathological jealousy? Well, it differs significantly from normal jealousy in its degree of intensity and more long lasting. It is characterized by serious feelings of insecurity and inadequacy as well as suspiciousness. Individual with healthy mind recover from jealousy fairly rapidly or through some coping mechanism, but pathological or extreme jealous people become obsessed by their fears and constantly look for signs that their suspicions are true. Individuals suffering from morbid jealousy are prone to severe anxiety, depression, difficulty in controlling anger, and may engage in self destructive behavior or elicit suicidal tendency. Extreme jealousy also creates significant risk of domestic abuse, emotional abuse of children in family where jealousy is a feature of the parental relationship. Pathological jealous people conclude that their partner is unfaithful on the basis of some distorted, baseless, unreal comprehension of unimportant situations in which they perceive many factors as a threat to their romantic relationship. A person who is pathologically jealous thinks he or she owns his or her partner or any loved ones, thinks that he or she has exclusive right of decision making on their partner's or loved one's behalf, and also believe that such things are necessary in order to preserve the love connection. They accuse their partner or loved one for paying attention to other people. They ask series of questions about the partner's behavior, checking their phone calls, messages, constant questioning where and with whom their partner has spent their time, trying to surprise the partner at work, at home, during unusual hours, or at other locations to catch them in the act, attempting to limit the partner's activities, or loved one's activities outside the home, possibly to the point of keeping them as prisoner, using of emotional blackmail to control over their loved ones, isolating the partner from family and friends, blaming other person for all the conflicts in the relationship. In most extreme version, abnormal jealousy can be dangerous to the health and safety of those who are the subject of the extreme jealousy. There is a legitimate risk of a tragic end if it is not addressed before they escalate. It is unlikely to disappear without mental health treatment. It should be evaluated by psychiatrist and psychologist. It is a form of psychotic illness and should be addressed with all the urgency. When any person is experiencing extreme or abnormal jealousy, it can also cause changes to the body. Physical symptoms may occur when jealousy arises, like stomach aches, headaches, chest pain, high blood pressure, palpitation in extreme anxiety, weight gain or loss, insomnia or disturbances in sleep, and weakened immunity. I mean, these physical symptoms may occur with the extreme jealousy, but that doesn't mean that the symptoms are occurring. I mean, the stomach aches or headaches are occurring, and that does not mean the only cause is the extreme jealousy. Causes may vary, but thing is that in extreme jealousy, this kind of physical symptoms occur because definitely mind and body are same, and there is a connection between the emotion and the physiological arousal. So definitely body or physical health also affect by extreme jealousy. Now let us discuss about the causes and risk factors of this abnormal or pathological jealousy. Well, extreme jealousy or pathological jealousy are more likely to be experienced by those who have been diagnosed in the past with anxiety disorders, schizophrenia, personality disorder. There is a symptomatic overlap between delusional jealousy and two personality disorders, in particular paranoid personality disorders and borderline personality disorders. Brain injuries or diseases like Huntington's disease and Parkinson's disease can cause delusional behaviors. Other causes like substance use disorders. People with alcohol use disorders may show symptoms of morbid jealousy. A highly jealous person tends to have a deep seated fear of abandonment. This frequently originates in childhood. If one or both the parents were emotionally distant or emotionally unavailable or emotionally neglectful, the relationship patterns with parents are anxious, insecure, or there was a constant criticism and comparison by parents during childhood. This kind of experiences of emotional abuse may trigger in future this kind of extreme jealousy symptoms, or if any unresolved childhood experiences, any childhood physical, sexual, or emotional abuse, any childhood trauma, this kind of traumatic experiences in childhood also develop this kind of symptoms of pathological jealousy in adulthood. Anyone who is experiencing irrational and disproportionate levels of jealousy would be wise to seek mental health professional immediately. These experts can unmask any underlying disorders and recommend a course of treatment that offers good hope for recovery.